Hello, thank you for joining the Clean Water for Carolina Kids Mitigation webinar. We'll be starting shortly once we allow a few more folks to join. The webinar today is designed for us to overview how to take action to get the lead out of your drinking and cooking water at your licensed child care center or school. This webinar and this program is a partnership between the North Carolina Department of Health and Human Services, Division of Child Development and Early Education, and the Division of Public Health, along with RTI International. My name is Jennifer Hopenick-Redman, and I'm the program director, and AJ Kondash, the program coordinator, is also participating today. We have 8 items that we will be overviewing during this webinar. 1, why is mitigation important? 2, our overall program results to date. 3, once I get my results, what do they mean? 4, where does lead come from? And we'll show low cost, no cost solutions. 5, how to view your results and receive on-site support. 6, how to share your mitigation with others. 7, helpful resources, and 8, we'll close with a live question and answer session. First, why is mitigation important? Any amount of lead exposure causes irreversible and lifelong cognitive and behavioral deficits in children. And because of this, once you receive your specific results, you'll know where to take action to get the lead out. This webinar overviews how to get the lead out. And we want to make sure that you know that it's often simple and low cost. And we're going to overview what those solutions are and what happens in the limited cases where it takes additional support. Our program results to date include the majority of centers in the state. The average concentration of lead that we have found is 3 parts per billion. The maximum concentration we found is almost 4,000 parts per billion. And we talk about lead in context of parts per billion, which is like 1 drop in an Olympic-sized swimming pool. 93% of centers do have at least 1 tap with detectable lead. And you'll see in our figure to the right that 9% of centers have at least 1 tap with 15 parts per billion of lead. So what do these numbers mean? The next section is designed for us to overview what they mean and what you can then do about it. As I mentioned, lead is measured in parts per billion, and we measure it at such low levels because at low levels, children can have those cognitive and behavioral deficits. In North Carolina right now, action is required when we find lead at or above 15 parts per billion. However, any amount of childhood lead exposure should be prevented if possible. In this next video, we're going to overview how to further understand your results and what you can do next.
Welcome back. I'm Jenny Redman from RTI International. Now that you've had your drinking water tested at the laboratory, you're waiting for your results. We will send your results via your email. If you do not have email, we will also mail those results out. Your laboratory results will be divided into 3 categories. The first category will be results that are above the North Carolina action level. The second category are results that are below the North Carolina action level, but above the laboratory detection limit. And the third category are results that are below the laboratory detection limit. For results above the North Carolina action level, the state or local public health department will notify you and come visit your center to check the tap and resample it to confirm the laboratory result. While that tap is resampled and it's being analyzed at the state public health laboratory, you want to make sure that you do not use that tap. You will place a do not use sign over the tap to ensure that no children or staff are using it. Once the second sample is analyzed, we will identify whether it is still above the lead hazard level. If it is, the state or local health department will help you identify the best way to get the lead out of that tap. 3 recommendations are: 1, to contact a plumber and make sure you don't have a clog or an issue with the pipe. 2, to potentially change your faucet fixture, which may contain elevated lead. And 3, to install and maintain a filter that is certified to remove lead. The second category of results are those that are below the North Carolina action level, but above the laboratory detection limit. Our laboratory detection limit is 0.1 part per billion. We will let you know of those samples in the report, but you will not get a visit by a local or state official. Now, since any level of lead is not good for children to be exposed to, we still do recommend no-cost or low-cost solutions to get that lead out as well. Some of those recommendations can also be installing and maintaining a filter, or it may be something like flushing water in the morning. Make sure that your clean water habits include only using cold water for drinking or cooking. Even if you're going to boil water, don't start using the hotter water. Make sure you start cold and then you would boil the pot. Another thing to make sure that you do is after holidays or weekends or other times when the child care center is not in use, you can flush water, for example, in the kitchen sink for several minutes, and that would help clear the pipes and put new fresh water into the center. Another thing to do is to always make sure that you contact a plumber if you notice that you have a clog or something that isn't working well at a tap. If you do not want to use this tap for drinking or cooking any longer, you can just change it over to a hand washing sink, and it would be acceptable to use it as a hand washing sink. If you do that, you want to make sure that you post signage that it should not be used for drinking or cooking. It's really important to make sure that you teach not just your staff, but also the children at your center to understand where it is appropriate to get water for drinking or filling up water bottles. Lastly, any results that are below our laboratory detection limit mean that there's a result that is below 0.1 part per billion. Now, for installing and maintaining a filter and also for replacing faucet fixtures that may be problematic, please reference our next videos. You can find more videos on NC Child's YouTube channel. With your help, we can ensure that our children are drinking clean water while they're in childcare.
Next, we're going to overview where does lead come from and how can I get it out using no-cost and low-cost solutions, and how can I check for a lead service line. So where does lead come from? Lead typically isn't found in source water, and it's also usually not found at the water system. It actually typically accumulates in the piping and plumbing on the way to your household, your center, or your school. First, we're going to talk about where it can be found inside the building and how you can get it out there. First of all, no-cost clean water habits are always good to practice. This includes designating taps for drinking and cooking with proper signage, and also only using cold water for drinking or cooking. Don't start using hot water, even if you're going to boil it or want an infant formula bottle to be warm, because that can leach extra lead. Low-cost risk mitigation includes several things, including 1, fixing a clog. If you notice that a tap or a water fountain isn't running as quickly as normal, there might be a clog in there, and sometimes that can make small amounts of lead break off and come into your water. Second, flushing water regularly is very important, especially after the weekend, after holidays, and with COVID-19, after prolonged closures or underused portions of the building. Sometimes with COVID-19, you may actually want to flush water for over an hour at all taps for prolonged closures or after the summer holiday to make sure all of that old water flushes out and you get new fresh water in. After holidays or the weekends, flushing water for a few minutes may be sufficient. Third, changing your faucet fixture to a new stainless steel fixture can get the lead out in certain cases. Older faucet fixtures do have allowable levels of lead in them, and so sometimes this is the problem. Fourth, installing and maintaining a water filter that is certified to remove lead can be an effective solution in most cases. And fifth, installing a bottle filling water fountain with built-in filler can be a good option at centers and schools where you still want to have a water fountain option, but there's a certified water filter in there. And with COVID, you can actually fill up with bottles instead of drinking out of the fountain. Next, we're going to talk about how to check for lead service lines. Sometimes the problem may be associated with the piping that comes from between the public system and your building. To check for a lead service line, you'll need a metal tool, such as a screwdriver, and a magnet. Step one is locating where the water line enters the building. Typically, this is in the basement or lowest level. Look for the water meter and identify the inlet valve going into the building. Step two, scratch off rust or corrosion on the outside of the pipe. Find a place to examine and use the metal tool to scrape off any rust. If there's covering around the pipe, you might need to uncover or unwrap the pipe first. Step three is seeing if a magnet sticks to the pipe. If it sticks, it must be galvanized steel, which is typically a dull gray. A magnet will not stick to lead or copper pipes. If the magnet doesn't stick, then you'll need to check the color of the pipe. Lead pipe is typically silver or gray, and copper pipe is typically the color of a penny. Lead pipe you also can easily scratch with a coin. So if you think that it looks like lead, you can also take a coin and try to scratch it and see what happens. If you do find that your service line appears to be lead, there will be additional support. You can contact your state or local health official, your water utility, and see what the next steps may be to replace the lead service line. Next, AJ is going to overview how to view your results and receive on-site support.
All right, thank you, Jenny. On your results dashboard, you'll want to click this blue View Your Results button to view your center's results. On your center dashboard, click that results button, and then your dashboard will come up. Table 1 in your results page will show each of the taps listed in your enrollment survey and collected a sample for. The lead concentration shown under the lead (PPB) header is how much lead we measured in each of your samples. We also provide a short recommendation based on how you should approach remediation at the tested level of each tap. We'll review this further in the next sections. This figure is also part of your results page. It shows the range of remediation recommendations based on your measured level of lead. We also show key benchmarks for lead concentrations, the 15 ppb state action level, the 1 ppb risk level of the American Academy of Pediatrics, and then our program detection limit of 0.1 parts per billion. So in order to understand this figure, if you have a sample that's at or above 15 parts per billion, like Jenny said earlier, you should stop using the tap immediately and wait for the environmental health specialist to call and schedule a confirmation or follow-up visit. If you have a tap that has measured below 15 parts per billion, we do recommend that you practice some of the low-cost mitigation measures at the tap that we overviewed in the previous sections. As we've said throughout this program, there is no safe level of lead, so we do recommend implementing low-cost mitigations all the way down to our detection level of 0.1 parts per billion, and every center should practice the no-cost clean water habits if possible. Now that we know where the lead is coming from and what actions you can take to fix it, we'll overview the process for state on-site visits. So if you do have a result that is at or above 15 parts per billion, a state or local environmental health specialist will visit your center within 10 business days. They will conduct an on-site visit and collect follow-up confirmation samples at each tap that measured at or above 15 parts per billion. They will then let you know the results of the confirmation samples. If your follow-up results are below 15 parts per billion, you don't need to take any further action, but we do recommend you still implement some of the low-cost remediation strategies. If your tested follow-up results are at or above 15 parts per billion, the specialist will work with you to develop a lead mitigation plan, then visit again to collect a sample after your remediation has been implemented. They will keep working with you until the post-remediation samples are all below 15 parts per billion. You can check your center's public mapper for results from the state lab, and the state specialist should also be in contact with you to overview the results of your follow-up samples. Next, we're going to overview how to share your mitigation and your results with others. After viewing your results, a list of your taps will now appear in the remediation measures section of your dashboard. If you click on the Select Measures box that's blue at the bottom right of your dashboard, you'll be able to list each of the remediation measures you've taken at each of your taps. If you push the Save Measures button, they will save your measures and appear on your public mapper page. To view your public mapper page, you'll want to click on the View Your Results button, and in your results page at the very bottom, there's a link for your public mapper. You can use this link to share your center's results with any of your parents, child care center workers, or other interested parties. The public results mapper page will list each of the taps you registered at your center, any state follow-up sampling results, and any additional testing that you ordered for your center, in addition to any remediation measures that you listed using the previous steps. If you had performed remediation on a tap that tested below the state action level, you can order a new test kit to collect a new sample for your newly remediated tap. Any results from ordered post-remediation samples will appear on your public mapper page under your initial results, helping you to show parents that you're working to get the lead out of your center or school's water. There's a small fee to retest taps, as only one round of sampling is covered by our current grant funds. We've created a video that walks you through step-by-step through this process, and it is available on our Clean Water for Carolina Kids how-to page. Next, we'll overview a few helpful resources that you can use to take the next steps to remediate your water, share your results, and other things. So first, all of the above remediation efforts are discussed in more detail in our remediation how-to videos. On the www.cleanwaterforcarolinakids.org/how-to page, you will find videos on how to choose a water filter, how to install a water filter, and how to replace a faucet. In addition to the videos, we've created flyers that walk you through the process of purchasing a water filter. They provide a few examples of filters that are certified to remove lead and provide you with an estimate of how much it will cost to purchase and maintain a filter. Additionally, we've created an FAQ page that has a lot of the frequently asked questions that centers are asking. These include questions on sharing your results from your public mapper, including remediation measures and how to get the lead out of your water, and recommendations based on your specific measured level of lead in your taps. So now we'd be happy to answer any questions that you do have live. You can simply use the raise your hand feature in Zoom and we can unmute you to answer your questions, or you can type them in the chat or Q&A box and we will address them as they come in. And again, thank you for participating in this webinar and helping to protect children's health. You can feel free to contact us if you do have any further questions that we don't answer live using our www.cleanwaterforcarolinakids.org/contact page.